Hi, my name is Scott. I'm the respiratory educator, and I'm going to teach you how to use a nebulizer to deliver nebulized medications for busy people. So what you're going to need is a nebulizer. Comes in a package like this. You're going to need your medication. Most of every medication we're going to give is going to be in a unit dose, so you don't have to measure anything out. Okay. Potentially you may need to use a mask because some patients will not be able to hold mouthpieces in their mouths. Okay. But first off, when we open up this package, there will be several pieces in it. One will be the medication container. And to put these things together, we'll just attach our oxygen supply to the bottom of that small volume nebulizer. There'll be a T-piece that will go on top of that. And this extra piece of tubing is considered a reservoir, okay? And then you have a mouthpiece, which will go here. I would wear gloves if you're touching any of these things, especially if you're going to touch the inside of this container. There is a little impact device in here that creates the atomization in here. Once you have this together, you're going to attach it to the wall to your flow meter. This is an airflow meter right now. What you're going to be finding on the floors is all going to be air. We've had too many problems in the past with someone thinking this is oxygen and placing a patient on air and thinking they're giving them oxygen. So you won't find air flow meters out on the floors. Okay. So in order to load this nebulizer, we'll take out our medication. Like I said, it's a unit dose, so we don't have to concern ourselves with how much. Just make sure you're giving the right amount. And there is a barcode on this packaging, so don't throw the packaging away before you scan it. It's not on that little fish. We call them fish. Okay. So then once we have that on, this is ready to go. Oftentimes you're going to have patients that are on oxygen, nasal cannulas, things like that. You'll have to take those things off or at least disconnect them from your flow meter. Keep in mind, remember to switch them back when you're done. It's very easy to forget. It will happen. You will not be able to tell just because you stopped the therapy and they're not on their nasal cannula. You know, their oxygenation isn't going to drop because you've been feeding them a lot of oxygen for a while. So they're going to be on a high for a little bit. Okay. So before you start the treatment, you want to make sure that you check certain parameters. You want to check vital signs. So most important thing for us would be heart rate. What we're going to be watching for is that heart rate does not rise more than about 20% during the nebulizing therapy. Some patients will have heart rate rise, but it is very rare. The other thing we're going to look for is the work of breathing. You're probably already going to know that because you've been working with your patient. You know how hard it is, how hard they are breathing. The other thing you're going to be listening to is breath sounds. So we're looking for what they are before we start so we can compare them to after the therapy. Okay? So once we got that going, we'll turn this flow meter on to at least 8 and no more than 10 liters per minute. And as you can see, there is mist coming out of both ends of this device. This mouthpiece will go in the patient's mouth. You want their teeth around this. And then their lips will seal on that. If they can't hold this, we have to deliver this a different way because you don't want to stand there and just be holding it for them. Odds are they won't be able to maintain that seal if they can't hold it either. The reservoir, this needs to be here because when we breathe in through this, we're actually pulling some gas in from the room. So this increases the amount of medication that we're actually bringing in, because at least we have this much more than we would have. So you'll see it like this. And you noticed how this disappears when I take an inspiration. That's something else you want to look for. If this is continuing to come out here and it's in the patient's mouth, they're not getting any medication at all. They're breathing through their nose. So you need to remind them to breathe through their mouth. You don't want them to breathe abnormally. If they're breathing too deeply, too fast, they're going to get dizzy, and that's not a good thing for them either. They'll get over it, but still, it's better for them just to breathe normally. If you can't get them to breathe through their mouth, again, we'll have to look at a different option. One option would be, well, probably the only option, is going to be a mask. So what we would do is we would take this portion off completely, and the mask would go on like this. Okay. Then you just put this on their face, and you can see when I breathe in, the mist disappears. There is a little bit of a decrease in the amount of medication they're going to get with the mask, more than likely, because of these holes, and when you draw in, you get air that mixes with this. Luckily, these devices are really for giving to patients for routine therapies. So they're generally not acutely ill. If your COPD patients and so forth are not going to have a profound effect from this medication as like an asthmatic might. Okay. So the other thing you should realize is that this device generally, when it's filled, requires about 3 cc's of medication. So if for any reason you do have to mix a medication, there are albuterol bullets that just have the medication in them. Then you would just take normal saline and pour it in there and get it up to about 3 cc's. And there are marks on the sides of this device that tell you how many cc's that is. Okay, so this is going to run probably about 10 minutes or so. When it starts to sputter, just stop. Once it starts sputtering, the particle size required to deliver good medication to the lungs is gone. It's just splatter at that point, and you won't be able to deliver anything of value at that point. Okay. Once this is done and it goes to sputter, you want to turn this off, and then remember to hook up whatever oxygen device that they were using before. Careful how strong you are about putting that on. Put your other device back on. Then the other thing is, which is a kind of a good idea, is maybe over a garbage can or something like that, just tap out that extra fluid, so the next time you come around it doesn't kind of add up on top of each other. Okay, and then take this and put this in a clean, secure place so it's ready for the next time. Okay. There are times, considering that you may be working with pediatric patients, that we do something called a blow-by therapy. Patient can't hold it. You can't put a small enough mask on their face. Then we do a blow-by, and then that means that the medication is just going to be coming out of this end, and we're going to blow it toward their face. Babies, obligate nose breathers, don't blow toward their mouth, blow toward their nose. We have a very high-tech way of setting up our device for that. We take our wrapper and we shove that in there like that. So that now just blocks off the mouthpiece, so all the medication comes out through the reservoir. Okay, it does reduce the amount of medication that the patient gets doing it in this way, but luckily the minute ventilation of an infant is so small that they will not pull gas from as far away as we do, so they'll get a little bit more than if you tried to do this to an adult. Okay. The only other thing that there's an off chance that you might come across are these breath actuated nebulizers, also called BAN, B-A-N, BAN breath actuated nebulizer. This device is very high efficiency. I would generally reserve these for our true asthmatic patients. Maybe use them in the emergency room. There's very little waste with these because they're breath actuated. They only nebulize when you take a breath in. They actually have a valving system on it that allows that to work. When I'm filling this, treatments can be given as little as 1 cc in this device. So if I were going to be giving albuterol and say the minimum dose would be a 1/2 ml, I would only put another half mil of normal saline in with them. So when I turn this on, I need at least 8 liters going through this, but you'll see nothing is happening. There's nothing coming out of that. If this little green knob on the top, if I breathe in, you'll notice that little green knob drop down, and then you heard that atomizing or misting start at that point. This is really good with your patients that talk a lot, so they want to talk and wave their hand around, so they're not wasting any medication while they do that. And then you can take another breath. The nice thing about this is that the particle size is much better than the other device, so it actually delivers more medication. So this may only last 2 minutes, but you're going to get probably 5 times as much medication into the patient's lungs with this device. So very good for an asthmatic patient. The other alternative is that because we're using unit doses, you can't limit how much volume is in this, but you should never have to run this for more than 5 minutes. So no matter what medication mixture you put in here, 5 minutes, stop. A lot of institutions will put half as much as an ordered medication in this device because they know that they're going to get 5-10 times as much deposition to their patients. So very high efficiency. Emergency room, you may see this. If it follows them up from the emergency room, it's possible that they could have one of these. If they do, let them keep it because it's better and it's faster for you. All of you are going to get your job done a lot quicker if you use this. Okay. You may get some complaints from your patients because they said that didn't last long enough. You just have to push the idea that this is much better. It's much more high efficiency than the other devices are. Okay. So you're done with your therapy. What you want to do is you want to listen to your patient's breath sounds. You want to see what their work of breathing is, and you want to check their heart rate. Odds are their heart rate is not going to be any different. For example, using this device, which gives you 5-10 times as much medication, has no more incidence of increased heart rate than the other device does. So the amount of medication really doesn't seem to matter. If they get a little jittery, it's probably more because they weren't really breathing normally while they were getting their medication. Most of the time when you get that jittery thing and you take their pulse hasn't elevated at all. It's just the jitteriness, and that'll pass. Them reporting that they feel better, very subjective. Can't put a lot of weight to that. they've been fed a bunch of oxygen for a while, sure, they'll feel better. So worker breathing, has their worker breathing actually improved? Has aeration, air exchange improved? Has wheezing stopped? Also, has wheezing started? Sometimes you don't hear wheezing when you have bronchial constriction because there's not enough air moving through to hear a wheeze. So you may start wheezing after the fact. That doesn't mean you need to give more and more and more. So it just means you got more air going through, you're good. So I don't think I have anything else to mention about this other than documentation. And of course, these are aerosol generating procedures. So when you are doing this, as you come in the door, you have a sign on the outside of your door. You need to mark down, flip it over, mark down the time you start this therapy, because the time you're in that room, you need to protect people from the outside. Okay. When you come out, you have to let us put down the time. In most cases, 75 minutes. There are some quicker exchange rooms, which are all marked on that sign, that can be as little as 30 minutes. Okay, so make sure you do that. And then later, when that time's up, erase all that and flip it back over. Okay, I think because people forget to do those things, people tend to start ignoring the signs. Okay, so other than that, hopefully this will help you out and you'll be able to give good therapy when we're really busy. Thank you very much.